One of my interests and challenges when I started work at the Smithsonian was the newly emerging fields of genetic engineering, biotechnology, and molecular medicine. How to document that? What to collect? I saw that they really developed, these technologies developed around particular instruments. So collecting those instruments and documenting, I thought would be the best way that you in a museum could capture that field. But the last section, 15 minutes, is of the tour of how ultracentrifuge machine is put together, literally step by step, how it's then tested, and then how it's packaged and put on a truck and taken out to wherever its final destination is going to be.
We are here to film a video history of Spinco, and we will begin by showing the manufacture of ultracentrifuges. Our host and tour guide this morning will be Ken Johnson, Program Manager.
Morning, Dr. Canales. Welcome to Palo Alto, Spinco Division.
Good morning, Ken.
Museum, but it's not a presentation about how to use social media to engage audiences with the museum. It's about what we might learn from the images that people have chosen to share with us. We use photo sharing websites like Flickr, not to say, here is my lovely photo, but to say, this is where I live, do you want to come visit? This is what I made, do you like it? This is what I saw, can you tell me what it is? And so similarly, we might use images to say, this is my experience of medicine. I think the question this raises is, how might we curate a gallery of other people's objects? When we have access to all these objects, what can we do with them? We're used to patient narratives, that's diaries, blogs, kind of stuff like that as a way of understanding the medical experience. How might we build on, use, understand visual narratives of people's medical experience like this? And we wonder whether kind of sharing and asking for new images might throw up unexpected aesthetics of the history of medicine. It's about moving away from the idea of acquisition and towards the idea of fostering and sharing.
And you're doing contemporary biomedicine, what often drops out is the voice. And the only way we're getting the voice now is through oral narratives and written narratives. And this is another way of bringing in the concept of voice, the vernacular voice, the street voice, the unprofessional voice.
Particularly, they were about the participation of other people being involved. It wasn't one person or a group of trained people in one field curating an idea or something, allowing other people and their experiences to be voiced.
And we have discussed to what extent there is a kind of counter-revolution going on here, that we are so tired in the sense of the kind of digital explosion. The digital world is everywhere. How can you escape it? And one way of escaping the digital overtake of our lives could go to a museum, because that's the only place in the world nowadays where there is no digital world.
All this is about is actually sharing stories and giving significance to the physical stories.
No, exactly. That is absolutely wrong. Because a physical object is not a story. Not even a collection of physical objects is a narrative. Because if you attach the term narrative to everything in the word narrative loses its meaning.
Is that you look at the object and sort of that is the marker of all of the social, political, economic issues that surround the making of that object.
The reality of most museums is how much of the collection is actually shown compared to the 95% or 90% that no one will ever see, which is what's so wonderful about what you guys did at the Science Museum. So there has to be some place for it. I think digital media is a really great solution for that problem.
What the digital media can bring to the museum. And I'm just wondering, there's been very little comment about what the physical museum and the traditional museum, what if anything that can add to this digital media?